The digestive system is responsible for breaking down food and putting it into a form that can be used by the body. Any problem that interferes with the body's use of food can cause a deficiency of nutrients. This deficiency of nutrients is known as malnutrition. Hi, I'm Kathy Getrust, and today's topic is on problems that can interfere with nutrition. There are multiple problems that can interfere with nutrition. First I'd like to mention is a lack of appetite. The medical term for lack of appetite is called anorexia. Many of you are familiar with that term, and there are many causes. First might be loneliness or depression. Our eating is a social event, and I'm sure you've experienced, as I have, that if I'm by myself, I don't eat nearly as much as I do if I'm with a group of people. So it does have an impact on our appetites. Another problem that can interfere with nutrition is the use of certain medications. Recently, I have taken care of a patient who was placed on Adderall. Adderall is a stimulant medication used for attention deficit disorder. And she went from 111 pounds to 85 pounds while taking Adderall in the course of about 2 months. It was necessary for the medication to be stopped because it was having such a negative impact on her nutrition. Illness is another thing that can cause appetite problems. One thing particularly is cancer. People with cancerous tumors that are taking more and more energy away from the body cause an appetite to be diminished. Immobility is another factor. People who have a very sedentary lifestyle that spend the majority of their time sitting in a wheelchair or lying in bed certainly are not going to be consuming the calories or have the energy requirements as someone that doesn't, and lots of times that shows up with a lack of appetite. Another problem is an individual's refusal to eat. The refusal to eat may be for reasons other than that they just don't have an appetite. It could be that they have problems with their teeth or dentures. Teeth might be very poorly taken care of, or they have dental caries, decay that are causing pain and swelling in the mouth. And illness, as most of you know, can be accompanied by a weight loss. When people have dentures and there's weight loss, it causes the dentures to be ill-fitting and can cause irritation in the gum tissue, and as a result they may refuse to eat. Might be that their foods are against their belief system. There are religious belief systems that prohibit certain kinds of foods to be eaten, and you're probably aware, for an example, of the Jewish faith won't eat anything of a pork nature, pork products, bacon, ham, any of those things are against their belief system. So if they're provided that, they're not going to be willing to eat it. Also, people who are vegetarians are not willing to eat any kind of meat product, even if it's broth that has been made from a beef broth or chicken broth, anything like that in soups will be items that will be unwilling to be eaten. Another might be that food may not look very appetizing. It might be that food that is supposed to be served hot is now cold. And you know what that's like to try to eat soup that's supposed to be hot, but it isn't, or potatoes or any other food. It's not very appetizing. Another thing might be the texture of the food. Maybe due to certain illnesses, people need to have their food blenderized, and pureed, blenderized food can look rather unappetizing. Nausea is another problem that people experience that can interfere with nutrition. Nausea, as we've probably all experienced, is that feeling of a need to throw up. It's a queasy feeling in the stomach that might be accompanied with retching or dry heaves. Retching is the involuntary attempt to vomit. It frequently will precede vomiting, or it might follow vomiting when there's no longer any food or liquid in the stomach. But it does have an impact, a negative impact on someone's interest in food. Vomiting is another problem. The medical term for vomiting is called emesis. It might be forceful, and the emesis might even be projectile. Projectile means that the vomit would project past the body. Important to note the color of the vomit, if there's any blood in it, and whether or not there might be any medications, if it's digested food or non-digested, the amount of vomit. If there's a very large amount, certainly the person may have to have some supplements to make up for the fluid that has been lost. Important also to report when this has occurred, if there's any pattern, if there's a particular time of day that this seems to be occurring, and the frequency. If it's once or if it's multiple times, you'd want to be sure to alert the nurse. Another problem is called gastroesophageal reflux disease. That's a really big term, and because of that, it's more commonly just referred to as GERD. The symptoms of GERD are heartburn, a sour taste in the mouth or throat, and it's caused by acid that escapes from the stomach and goes up into the esophagus and throat and causes that sour taste. Smoking, caffeine, and alcohol increase the level of acid in the stomach, causing even more heartburn. The treatment components for GERD include the avoidance of carbonated beverages or alcoholic beverages or other items that make the problem worse. And following a meal, these folks are kept in an upright position for at least 30 minutes after they've eaten, and that helps minimize the problem. Also, they usually sleep with their head elevated, and by avoiding tight-fitting clothes, there is less pressure that's placed on the stomach area, and that helps minimize the problems. Usually, people that have GERD have a weight problem, and so losing excessive weight can often